Good afternoon and welcome to Insights. My name is Karen Lawson and I'm a Strategic Consultant with Quirk Healthcare Solutions. All participant lines will be muted for the duration of today's presentation and will be unmuted at the end to allow for questions and answers. We will be recording this presentation and making it available for replay on the Quirk Healthcare YouTube channel. Information provided is not meant to be legally binding or represent prescriptive advice. Content is a synthesis of information currently available through other public sources. Today's presentation on Insight will focus on updates to the Patient-Centered Medical Home, or PCMH. The Patient-Centered Medical Home was first developed almost 20 years ago by the American Academy of Pediatrics, and it's been expanded and modified. In February of 2011, the AAP, along with the American Academy of Family Physicians and the American College of Physicians and Osteopathic Association, released guidelines for patient-centered medical home recognition and accreditation and described the conditions that comprise a medical home, established the standards that a formal PCMH recognition or accreditation program should incorporate. Today's presentation will provide an update on the current landscape and recent changes around PCMH, and will also build on the January 2014 Insights webinar that was titled PCMH Overview. This presentation will include a summary of the NCQA 2014 standard, also known as the new version. We'll also present advantages of vendor pre-validation of the electronic health record application, multi-site applications as they apply to practices that are seeking recognition, and alignment of measures with the federal quality programs, including Meaningful Use Stage 2. Now, for those of you that are currently seeking recognition, you may be aware that there are 4 primary groups that offer accreditation or recognition certification. There are also a group of others. Medical home recognition is offered by the NCQA, which tends to be the most prevalent group. However, there are also certifications available from AAAHC, the Joint Commission, and URAC. You can see the reference to the standards below the bullet point listing each of those 4 primary groups that offer PCMH recognition. Other groups include private insurers, employers, state entities, and so forth. Now, in January of 2014, the Medical Group Management Association released a report called the Comparison of the National PCMH Accreditation and Recognition Programs Report. Now, this report can be very helpful if your practice is currently looking at your options to be recognized or certified for medical home. The report compares the organizations that offer this recognition and how they differ in terms of whether the practice is qualified. The report includes evaluation methods, comparison, and also cost comparison among the groups. The 4 associations that have developed the PCMH concept focus on the area of having a primary physician or provider in a team-based practice as one of the primary focus areas. Also, having a whole person orientation with patient care. Thirdly, the focus is on providing coordinated and integrated care. Also focusing on quality and safety. And finally, providing enhanced access. The MGMA report is helpful for organizations that are looking to compare the program focus as they seek recognition. Now, what you're seeing on your screen is a map of the current layout of public and private PCMH initiative across the U.S. This is an important piece of information because practices need to keep current on what's happening in your region and in your state in terms of multi-payer, public, and private initiatives that impact your contracting and the operation of your practice within the market. PCMH recognition is continuing to grow across the U.S. This slide shows the PCMH 2014 content and scoring for the NCQA organization, and it highlights the 6 standards that are part of that NCQA medical home content, as well as the elements beneath those standards. You can see in blue on this slide that the 6 standards focus on enhancing access and continuity, the team-based care, population health management, the management and planning of care, the coordination and tracking of care, and then the measurement and improvement of performance. In the lower left, you can see the 3 levels of NCQA patient-centered medical home recognition that your practice may be seeking or seeking to maintain or increase. You can also see the points that are available next to the 6 primary standards and 27 elements. And you can see in bold with the asterisk marked next to those elements that are considered must-pass elements by the NCQA. What you're looking at is the new version, the 2014 NCQA content and scoring. Now, some important things to recognize as you're moving forward with NCQA recognition is that there are some advantages that your practice can take advantage of depending on your circumstances and your situation. One of the new changes with NCQA is that there is an electronic health record vendor pre-validation that's now available. And the reason this is relevant and important to practices is that evaluation of the electronic health record by NCQA can result in auto credit. So this is scoring that's transferable to the eligible practice that is seeking recognition. And what this means is that the functionality in the EHR has been recognized, evaluated, and recognized by NCQA in a way that significantly reduces documentation requirements, support, saving your practice quite a bit of time and alleviating some of the major administrative burdens on your practice for meeting the PCMH survey requirements by NCQA. So this is an important piece if your electronic health record has been pre-validated. You can either contact NCQA or you can visit their website for a list of the current 15 electronic health records that have been pre-validated. The other advantage that your practice may want to look into would be multi-site and multi-specialty submissions. Now, this is an option offered by the NCQA for practices with 3 or more sites that have specialty practice within them that are sharing an EHR. So if the electronic health record is being shared in a way that has standard policies and procedures, then these individual sites do not have to submit separate applications. So the sites are not required to submit at the same time, nor are they required to be the same specialty. They just need to answer in the affirmative. In bullet number 2 on this slide, there are 3 questions. Can the organization sign one agreement? Is there an authority that would cover all sites and specialties? Have all sites for a minimum of 3 months been sharing the EHR in the same way to document patient care? And do all of the sites operate under the same policies and procedures? If the answer is yes, this may be an option for practices to reduce what's required to submit for NCQA recognition. In this case, what you do is you complete the same survey tools as individual site applicants, but you don't have to repeat your responses or your documentation for many of the focus areas. So this is a significant benefit to practices that operate in this model. Now let's talk just for a few minutes about the NCQA 2014 standards and the updates. In the new version of NCQA 2014, the same standards are retained. The major difference is that the standards now align with meaningful use stage 2. We'll go into some of that alignment in a few minutes. What's new about the 2014 new version is that there's an integration of behavioral health. In this way, practices are now expected to collaborate with behavioral health providers and also to communicate behavioral health care capabilities to patients. Secondly, care management focus on high needs populations has been added. So what happens here is practices are now expected to address socioeconomic drivers of health and poorly controlled or complex conditions. Another change has to do with the enhanced emphasis continuing on team-based care. In this area, the revised NCQA standards emphasize collaboration with patients as part of the care team. And the new version also establishes team-based care as a must-pass criteria. Other changes in the new version include alignment of improvement efforts with the federal triple aim. So now practices must show that they're working to improve across all three areas of the triple aim, which are patient experience, cost, and clinical quality. Finally, the new changes require sustained transformation. So this is in keeping with the goal of continuous improvement, and practices must now show that they comply with NCQA standards over long periods of time. What you're seeing on the screen now is a timeline for the NCQA's transition from the Patient-Centered Medical Home 2011 standards to the new version standards in 2014. You can see here that in March of this year, the new version survey tool became available, and June 30th, next week, is the last date to purchase 2011 survey tools. Now, the NCQA has suggested that the last date to submit 2011 corporate survey tools for multi-site submission be December 31st, 2014. And on bullet number 4, you can see that practices can submit either the PCMH 2011 or the new version, 2014 standards, between March 24th of this year and March 31st of 2015. There is a document available that will help practices take a look at the items that are similar and those that are different among between the two standards, 2011 and 2014. And that document is available for download on the NCQA website. Very helpful for recognizing both the updates as well as the differences and the similarities. Now let's talk about the NCQA standard alignment with meaningful use stage 2. This particular change could be significantly helpful to practices that are transforming and implementing new workflows, new documentation, and training. Due to the new alignment, in standard number 1, which focuses on patient-centered access, in the NCQA new version, elements A, B, and C all have at least one measure that now aligns with the objective and threshold for meaningful use stage 2. In the second standard area, which is the team-based care, you can see that there are now 4 alignment elements that cross over with meaningful use stage 2. Again, helping practices that are transforming to focus on those changes that will comply across the board with different federal programs. In the NCQA 2014 standards, number 3 on population health management now includes 5 elements that cross over with meaningful use, stage 2. You can see the focus of those elements that cross over on this slide. Standard number 4 also has a crossover now of 5 elements with meaningful use, stage 2 measures. And then for standards number 5 and number 6, you can see those elements on this slide that now cross over with stage 2 meaningful use. Now the NCQA has on-demand recorded training that's extremely important and very helpful for all practices that are beginning their process of transformation and intending to seek recognition. In addition to those recording trainings, there are also in-person live trainings that are available and coming up. You can see on this slide there are a number of dates on the East Coast as well as the West Coast coming up that will help practices with an introduction to PCMH and also learn about the Advanced PCMH 2014 standards, foundational concepts, and the advanced topics again. So we'll pause just a moment in case anyone is taking down these dates for upcoming NCQA training. This brings us to the end of today's update presentation on the patient-centered medical home. Quirk Healthcare Insights webinar, July the 9th, will be focused on data conversion and database merges. We encourage you to attend the Insights webinar on July the 9th. And at this time, what I'd like to do is unmute everyone and open up for any questions and answers from today's update presentation on the patient-centered medical home, alignment with meaningful use measures, the new 2014 NCQA standards, multi-site, multi-specialty submission, and pre-validation. Are there any questions from the audience at this time? Hearing no questions, we'll conclude today's presentation. Again, it will be available for replay on the Quirk Healthcare YouTube channel. We want to thank everyone for your time and attending the Insights webinar today, and we'll look forward to including you in our future events. Thank you.